Hi, everyone. Welcome to a brief update from the Governor's Institute's Addiction Medicine podcast. While we're working on new episodes, we wanted to take a moment to share something we're excited about. This April 9th to 11th, we'll be hosting the 2026 Addiction Medicine Conference in Asheville, North Carolina. It's an in-person and virtual event designed to bring together healthcare providers working across the addiction care continuum. If you've been listening to this podcast, you already know the kinds of conversations we value: practical clinical insight, emerging trends, thoughtful discussion, and real-world challenges. The conference is very much an extension of that same mission, just in a live, interactive format. Today, I'm joined by someone who plays a key role in shaping this event, Paulin Williamson from the Governor's Institute. Paulin is our Director of Physician and Advanced Practice Provider Initiatives. Thanks for joining me today, Paulin.
And thanks so much, Amy. I'm really glad to be in the studio with you today to talk about the conference.
Okay, so let's start with the big picture. What themes guided this year's agenda?
All right. Well, this year we focused on the realities that clinicians are facing right now. That includes increasing patient complexity, especially co-occurring mental health and substance use disorders, the continued impact of the changing drug supply, and the need for patient-centered care and practical harm reduction strategies. We tried to be very intentional about balancing cutting-edge updates with applicable clinical content. The goal is for attendees to leave with insights that they can use immediately in their practices, whether that's diagnostic approaches, medication strategies, or engagement techniques.
What clinical topics seem to be generating the most interest?
Well, as I said, many providers are looking for ways to improve access and continuity of care in addiction medicine. During the conference, attendees will be able to explore models for improving patient access to treatment, reducing stigmas, enhancing care during transition periods, and really collaborating across various healthcare settings to ensure ongoing support for individuals with substance use disorders. We're also seeing a lot of interest in complex co-occurring disorders. Providers are seeing more patients with overlapping psychiatric, medical, and substance use conditions, and they're looking for integrated treatment approaches that work. And of course, guidance on implementing newer regulations, focusing on patient-centered care and harm reduction, those both remain major areas of engagement, especially practical ways to implement these things across different care settings.
And this year includes something special on Thursday, right? Tell us about the pre-conference day.
Yes, the Thursday, April 9th, is our pre-conference day. It's something that's been popular in the past, so we brought it back. And this year, we'll take a deep dive into motivational interviewing. And then the other co-occurring session is on perinatal substance use disorders. This day is designed to be highly interactive with hands-on learning, small group discussion, and a lot of early networking opportunities. I will say that registration for the pre-conference is limited, and it's actually nearly sold out for this year. So if either of these topics are something you're interested in, make sure you register quickly.
Okay, so that's Thursday's focus. Who else should consider attending the overall conference?
The conference is designed for a broad clinical audience: physicians, nurse practitioners, physician assistants, therapists, pharmacists, nurses, really anyone involved in caring for patients with substance use disorders. The content we have planned is especially valuable for clinicians who want practical tools, interdisciplinary perspectives, and then updates that reflect real-world practices rather than just a purely academic discussion.
For listeners who may not be able to travel to Asheville, there's a virtual option, right?
Absolutely. We offer virtual attendance options that allow the participant to access the conference sessions remotely. This makes it accessible to clinicians across North Carolina. And in fact, over the last several years, we've had participants from other states, of course, but then also other countries. The virtual experience still provides high-quality educational content and connection. The only thing virtual participants can't access are all of the breakout sessions. If you register for the virtual package, you have a pre-selected workshop option for each of the 2 breakouts. Not to worry, though. We've chosen 2 great topics. On Friday, you'll learn about practical tools to treat pain in your patients with addiction. And on Saturday, a closer look at methadone's role in the age of fentanyl, considering how much is enough and how much is too much.
Paula, what do attendees often tell you that they value most?
2 things consistently come up: the practical nature of the sessions and the opportunity to connect with colleagues. People appreciate learning from faculty who are actively practicing and who understand the constraints that clinicians face. And the networking, all those informal conversations where providers realize they're not alone in their challenges, seems to be incredibly meaningful.
And it's worth noting, continuing medical education credits are always a strong draw. And this year, nearly 20 hours of CME are pending, right?
Absolutely.
What makes this year's conference particularly timely?
Well, right now, we're at a moment of significant change. Patterns of substance use are evolving, and the healthcare landscape is changing rapidly as a result of new priorities and strategies at the federal level. These changes in policy, research, grant making, and reimbursement all serve to impact substance use disorder prevention and treatment. So clinicians are dealing with a lot. Burnout is always an issue in the practice of medicine, but it seems to be an even more serious concern lately. So this year's agenda also acknowledges clinician well-being, sustainability, and strategies for maintaining effectiveness in challenging care environments.
So you're obviously excited about this conference. I can see you smiling while you're talking. What sessions are you most looking forward to?
You're absolutely right. I'm very excited about the conference, and there's so many great sessions. It's hard to choose just a few that I'm especially excited about. But personally, I'm excited to hear from Dr. Stephen Lloyd. He is the real-life inspiration behind Michael Keaton's character in the show Dopesick. And then experts from the North Carolina Society of Addiction Medicine are going to be facilitating a discussion where he describes the opioid crisis, drawing from his medical background as well as his personal struggles with addiction. I'm also looking forward to hearing an update from UNC's Opioid Data Lab about what is in the drug supply, followed by several rapid-fire sessions presented by our state's addiction medicine fellows. These sessions will be focused on novel benzodiazepines, kratom, and medetomidine. There's also great sessions planned focusing on treatment of adolescent THC and nicotine vaping, and a urine drug screening debate to answer the question of to pee or not to pee. With the lineup that we have, I truly believe that if you work with individuals with substance use disorders, you will find the content relevant and applicable to your work.
That sounds awesome, Paul, and thank you so much for giving us this preview. For listeners who would like to attend, you can find full conference details, including agenda, CME information, and registration in the show notes. You can also go right to our website, addiction-medicine.org/spring conference. Whether you join us in person in Asheville or virtually, we'd love to have you there. Thanks for tuning in, and we'll be back soon with new full episodes of the Addiction Medicine Podcast.